Tonight, more cases of swine flu. The World Health Organization moves closer to declaring a global pandemic. And U.S. officials warn against traveling to the epicenter of the outbreak, Mexico.
We are taking it seriously and acting aggressively.
I'm Katie Couric. Also tonight, the plan to save GM. Tens of thousands of job cuts and the end of the road for the nameplate that took Lucy to Hollywood and made movie stars of muscle cars. The fall of AIG. CBS News learns 3 former executives are the focus of a criminal investigation. Did they mislead the public? And a football game goes into overtime. Touchdown. 15 years of it.
This is the CBS Evening News with Katie Couric.
Good evening, everyone. We're beginning tonight with the outbreak of swine flu that is spreading around the world, including at least 40 cases now right here in the United States. Ground zero for this outbreak is Mexico, and U.S. health officials advised Americans today not to travel there. Nearly 2,000 cases have been reported in Mexico and at least 149 deaths. Swine flu is now confirmed or suspected around the world, from North America to New Zealand, Europe, to the Middle East. The World Health Organization just raised its alert by 1 level, putting it 2 steps away from declaring a global pandemic. Here in the U.S., swine flu has shown up in 5 states. So far, fortunately, no one has died from it. We have a team of CBS News correspondents deployed tonight to bring you comprehensive coverage of this flu outbreak. First, Kelly Wallace, right here in New York City.
The doors at St. Francis Prep in Queens, New York remained closed, with classes canceled and workers sanitizing every hallway and classroom over the weekend. 28 students here are confirmed with swine flu. Another 17 cases are likely.
Oh my God, I didn't know. Oh my God.
Kate O'Byrne just learned her best friend, who went to Mexico for spring break, is one of the confirmed cases.
I just think it's crazy, and I'm kind of nervous to go back to school.
In Texas, where 2 cases are confirmed, 14 schools have shut down indefinitely and are also being scrubbed from top to bottom.
Doorknobs, light switches, surfaces, desktops, just anything that we feel that gets touched a lot.
President Obama said his administration is closely monitoring the emerging cases of swine flu in the U.S.
And this is obviously a cause for concern and requires a heightened state of alert. But it's not a cause for alarm.
At the National Swine Flu Command Center at the Centers for Disease Control, officials say there is no evidence the virus is spreading outside infected communities, such as St. Francis Prep, but say that could change.
I expect that we will see cases in other parts of the country, and I would fully expect that we'll see a broader range in terms of the severity of infection.
The CDC is releasing 11 million doses of the stockpiled antiviral drug Tamiflu to affected areas. New York City pharmacists report a run on the drug, which requires a doctor's prescription. But the CDC fears that doctors giving it to patients who don't really need it may cause shortages for those who are sick. Ariana Drouch, a swine flu victim from St. Francis Prep, told us by phone her family can't find it anywhere.
We've called every drugstore in Queens, New York, everywhere, and there's no other Tamiflu available right now.
A 1976 swine flu vaccine killed 25 people and panicked Americans across the country. The doctor in charge of New York's efforts back then said officials have learned much since 1976.
I think now we have much more information about this particular virus and how it behaves, especially here in the United States, whereas thus far it has caused very mild infection.
Federal officials emphasize there's no reason for Americans to panic, noting what they're seeing here in the U.S. is not the severe and deadly situation in Mexico. Katie?
Kelly Wallace in New York City. Kelly, thank you very much. We want to take a moment now to explain the World Health Organization's pandemic alert level. It was raised today to phase 4, meaning the virus is causing outbreaks at the community level. Phase 5 would mean the virus is spreading human to human in at least 2 countries in 1 region of the world. Then, if community-level outbreaks were reported in at least 1 other country in a different region of the world, that would be Phase 6, meaning a global epidemic is underway. Now to ground zero for this outbreak as the flu continues to spread in Mexico. Officials there are trying desperately to locate the source and to stop it. Hari Srinivasan is in Mexico City tonight with the latest from there.
In Mexico today, fear seems to be as contagious as the virus itself. Soldiers hit the streets armed with millions of protective masks. The government shut down. 33 million children were kept out of schools, and hospitals are being overrun by thousands after authorities urged the sick to seek immediate medical care. This woman, sick with a fever, was turned away from one clinic because it was full. This mother lost her baby.
The baby couldn't breathe, and eventually he got worse, and he couldn't be saved.
As the number of cases continues to climb, Mexican and American health officials are urgently trying to zero in on the origins of the outbreak. The key question, whether anyone got sick after coming into contact with pigs.
We're not finding that linkage here. I know that in the investigations in Mexico, they'll be looking as well to see, is there any connection?
One potential lead, massive industrial hog farms like these that have sprung up in Mexico in recent years. Some operated by U.S. companies such as Virginia-based Smithfield Foods. They deny being the source and say they're cooperating with health officials. But just last year, a report by the nonprofit Pew Charitable Trusts warned that hog farms could become breeding grounds for new strains of the flu.
The warm conditions and the close proximity of animals being able to pass viruses back and forth and to the human workers, it's a situation ripe for the development of a novel virus.
This is the scenario